President Obama's former White House doctor is not mincing words. Dr. Jeffrey Kuhlman has said Biden should have been given a cognitive exam. He even argues for cognitive tests for all older candidates and presidents in his book, Transforming Presidential Healthcare. Dr. Kuhlman joins us now. Thanks so much for joining us. First of all, what did you make of Dr. O'Connor invoking the Fifth today in this congressional hearing?
Good to be with you, Elizabeth. There's actually two things. For medical questions, he actually stated doctor-patient confidentiality, which for over 25 years since the time of Hippocrates, whatever I see or hear in the lives of my patients, I will keep secret, considering all such things to be private. So for the medical questions, I think that is appropriate, and he should not have answered anything about the diagnosis, the workup, the test, the procedures, and that's governed by doctor-patient confidentiality.
Right, but he was asked about whether or not he was asked to cover something up, and that's what he refused to answer.
Yes. So for non-medical questions regarding former President Biden, a wise physician should listen to the counsel of their legal counsel. They should listen to that advice. So I actually think that as a physician, we're not experts in everything, and he's going to listen to the advice of his legal counsel.
Why do you have said he should have given President Biden a cognitive test? As you well know, at that point in the country, like somewhere around 80% of all Americans, Republican and Democrat, thought he was too old and thought he was suffering from consequences of being too old cognitively. Why wouldn't Dr. O'Connor have given him a cognitive test?
So just kind of to clarify what I put on the record over a year ago is age is the #1 factor for cancer, for cardiovascular, and for neurocognitive decline. And past the age of 60, it's a fact of science that humans, our cognitive decline accelerates in memory, reasoning, speed of processing, and spatial visualization. It stays the same in vocabulary. So what I said was, at the time he was 82-year-old candidate, he would benefit from he would benefit from neurocognitive testing on a periodic basis, annual basis. But I also said 78-year-old candidate, President Trump at the time, would also benefit from that. So it's more than just a 1-minute screening test. It needs to be appropriate neurocognitive assessment. So both of them would benefit from that, along with we have a gerontocracy. We have 27 senators over the age of 70. Yeah. We have scores of congressmen. We have 4 Supreme Court justices. And the 20 senators, we have a 91-year-old who's a leader. We have 5 octogenarians. So my opinion is all of them, I'm not doing politics or policy, just trusted medical advice.
They should all have a test.
Absolutely. That's medical advice.
Super quick, because we're completely out of time. But 4 months before that debate, that terrible debate for President Biden, his doctor released a medical report saying he was a, quote, robust 81-year-old man who was fit to serve for 4 more years. I don't know if anybody looked at Joe Biden on that stage, President Joe Biden on that stage, and thought he was robust. There's a disconnect there, and that's what raises so much suspicion right now. Can you understand that?
Yeah, the 2 parts of that. Robust is not a medical assessment. That's subjective. We should leave that out of our reports. We should stick with the facts. And then when he said he's fit for duty, unfortunately, that's a little bit subjective. The U.S. Constitution or the Code of Federal Regulations, there are no physical or mental requirements for the office of president. And you got to be 35. You got to be a U.S. American-born citizen, which we know isn't true. And we need to have better guidance. And I think that would help all of us to avoid situations like today.
Dr. Jeffrey Kuhlman, thank you. Really appreciate it.
Good to be with you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.